Number 1. 烧山火 heat-inducing method, or sometimes we call it burning mountain. This technique is combination with the speed, lifting or thrusting or rotation needles, and the numbers 9 or 6, and the open-close technique. Occasionally, combination with respiration method. So generally say it can inducing heat sensation, so that's the name coming from. Clinical applications, mainly for tonify, especially for cold syndromes. The technique: insert the needles to the shallow level first. Heavy 13 needles, slightly lifting needles for 9 times. Or you can rotation the needles clockwise for 9 times. Then insert the needles to the middle level and repeatedly heavily thrusting, slightly lifting, heavily thrusting, slightly lifting for 9 times, or rotation the needles clockwise for 9 times. After finish 9 times, insert the needles, go to deep level, and repeatedly heavily thrusting, slightly lifting, heavily thrusting, slightly lifting for 9 times, or rotation the needles for 9 times. That's the 1 degree. You can repeatedly go back to superficial level and repeatedly 9 times, heavily thrusting, slightly lifting for 9 times, and then repeatedly go to middle level 9 times, deep level 9 times. You can repeatedly to do few times, and after few times you can withdraw the needles and then cover the hole, or maybe you can keep the needle in the air for some times. That's the technique we call 烧山火 heat-inducing method, or burning the mountain. Number 2. 透天凉 cold-inducing method, or through cooling. This technique a combination of the speed, faster or slow, lifting and thrusting, or rotation the needles for times and numbers, and open close, sometimes combination with respirations. It can reducing cold sensation, so that's the name coming from. It is a stronger reducing technique, generally used for reducing heat and treat excessive kind of heat syndromes. The technique: insert the needle, go to deep level first, then heavily lifting the needles, slightly insert the needles for 6 times. You can lifting 2 times and research the needles 1 times. Repeat 3 times, or you can lifting for 3 times. Insert 1 times. Repeat for 2 times. Then move the needle, go to middle level. repeatedly 6 times. Then lift the needle, go to superficial level, repeatedly 6 times. That's 1 degree. You can repeatedly go to deep level again, and 6 times on deep level, and 6 times on middle level, and 6 times in superficial level again. Or you can rotation the needles more counterclockwise for 6 times. Then go to middle level 6 times. Then superficial level 6 times. After repeated several times, you withdraw the needles and keep the hole open. So that's the technique we call 透天凉法 or cold inducing method. Number 3. 阳中引阴法 in heading in yang method. This technique uses in the same points, and the tonify technique used first, then reducing technique. Clinical use patients have both excessive condition and deficiency condition. So that's first tonify and then reducing. Technique. The needle insert to the superficial level first, and tonify in the superficial levels, like 9 times rotation the needles clockwise, or maybe heavily insert needles, slightly lifting, heavily insert needles, slightly lifting for 9 times. Basically tonify in the superficial level, that's the yang level. And then insert the needles go to deep level, that's the yin level. Reducing in the deep level or yin level. Heavily lifting, slightly insert, heavily lifting, slightly insert for 6 times. Or you can rotation the needles counterclockwise for 6 times. Then withdraw the needles. So that's the technique we call 阳中引阴法 or in heading in yang method. Number 4. 阴中引阳法 Yang heading in yin method. This technique uses the same points with reducing technique first, then tonify. It is a combination technique, both tonify and reducing. Thus, clinical use patients have the problems excessive with deficiency. Patient may be cold, follow fever. The technique. Insert the needles, go to deep levels, and reducing in the deep level first, like a heavily lifting, slightly inserting, heavily lifting, slightly inserting, or rotation the needles 6 times, counterclockwise. Then withdraw the needles, go to superficial levels, and then tonify in the superficial levels, like a heavily insert needles, slightly lifting, heavily insert needles, slightly lifting for 9 times, or rotation the needles clockwise 9 times. Then withdraw the needles. That's the technique we call 阴中引阳法 Yang heating in yin method. Number 5. 子午导灸法 Left-right rotating Up-down thrusting lifting method. 子午 means rotating the needles to the left side and the right side. 导灸 means thrusting and lifting the needles up and down. This technique combination rotation the needles and lifting thrusting the needles. Clinical use lending the qi between yin and yang and go to some special directions, and stimulation, tonify, and reducing. Clinical use reducing some edema and treat some floating sensation and promote urinations. Method. Insert the needles and then getting qi. After getting qi, heavily thrusting, slightly lifting, heavily thrusting, slightly lifting the needles 9 times. Then heavily lifting and slightly thrusting, heavily lifting, slightly thrusting for 6 times. And the combination with rotation the needles. And can repeatedly to do it. So that's the technique we call 子午导灸法 Left-right rotating Up-down thrusting lifting method. Number 6. 龙虎交战法 Dragon Tiger Struggling Method. This method uses rotation the needles to left side and right side repeatedly. Clinical mainly applications is relief pain. Method. Put the needle in and getting qi sensation, then mainly rotation the needles to the left side 9 times. Then rotation the needles back 6 times. You can repeatedly to do it, or you can separate to do it in the shallow level, middle level, or deep level. Then keep the needle there for some times. That's 龙虎交战法 Dragon Tiger Struggling Method. Number 7. 龙虎升降法 Dragon Tiger Ascending Descending Method. This technique clinically used mainly moving qi and relief pain, treat painful situation, and also harmonized between yin and yang. After insert the needles and getting qi sensation, then use the right hand, turn the needles to the left side, make the needles clockwise, and then use another hand, turn the needles back. repeatedly to do it, and also combination with ascending descending when rotation the needles to the left side, descending the needles when rotation the needles back, ascending the needles. That's combination technique. Left turn means dragon, right turn means tiger. So that's dragon descending, that's tiger ascending. Repeatedly to do it. That's 龙虎升降法 Dragon Tiger Ascending Descending Method. Number 8. 龙虎升腾 Dragon Tiger Rising Method. Dragon Tiger Rising Method uses needles, turn left side and right side, and then bending the needles, more moving qi. Clinical use can treat qi and blood stasis caused painful situation, usually severe kind pain in the chest and abdominal area. Method. Insert the needles, then getting qi in the shallow level. Rotation the needles to the left side, then pushing down. Rotation the needles to the right side, then pushing down. Then bending the needles. Repeatedly this for 9 times. Rotation the needles left side, pushing down. Rotation the needles to right side, pushing down, bending the needles. That's the second time. After 9 times, put the needle to deep level and rotation the needles to right side first. 1 circle and lifting the needles. And rotation the needles to left side and then lift the needles. Then bending the needles. And repeatedly rotation the needles to the right side, then lifting the needles. Rotation the needles to the left side, then lifting needles, bending the needles. That's 2 times. Repeatedly for 6 times, and then keep the needle there, or withdraw the needles. That's the technique we call 龙虎升腾 Dragon Tiger Rising Method. Number 9. 龙虎交腾 Dragon Tiger Crossing Rising Method. This technique rotation the needles left side, right side, and lifting and thrusting the needles, flanking the tail of the needles, promote qi circulations. Clinically, can use this technique to treat acute conjunctivitis and on-site carbuncles and febrile diseases. So insert the needles and getting qi sensation, rotation the needles, left side, right side, that's 1 times, repeatedly 27 times, left side, right side, left side, right side, left side, right side. Then after 27 times, put the needles more deeper and turn to left side and pushing down. and then flex the needles. After flex needles, can make the needles lifting and thirsty, promote qi circulation there. And then can withdraw the needles, or you can keep sometimes. That's the technique we call 龙虎交腾 Dragon Tiger Crossing Rising Method. Number 10. 进气法 Qi pushing method. Insert the needle to the deep level and tonify in the deep level. Then bending the needles, pushing qi to special directions. This technique clinically treats painful situations like pain in the back, waist area, elbow, and knee. So insert the needles, go to deep level, and then getting qi there. Then we tonify technique, like a heavy pushing down, slightly lifting, heavy pushing down, slightly lifting for 9 times. After 9 times, bending the needles, the tip of the needles go to specially where is the painful situations, thus sending qi to that direction. This technique we call 进气法 Qi pushing method. Number 11. 流气法 Rotation of qi method. This technique combination of slow or faster needling technique and lifting and thrusting technique is mainly keep qi in the local area. Clinical applications mainly use dispersing abdominal methods. So insert the needles and getting qi. Go to middle levels and then manipulation the needles with tonify technique, like quickly and heavily downward and slightly lifting, quickly downward, slightly lifting for 9 times. Then put the needles to the deep regions, and then lift the needles to originally middle regions, keeping qi in the middle regions, thus keeping qi in there to disperse some stagnations under the needle area. So this technique we call rotation of the qi method, 流气法. Number 12. 抽天法 Repeated lifting and pushing method. This technique repeatedly lifting and thrusting the needles in different levels, deep level and shallow level, and upper low regions. Clinically treat paralysis and some skin issues. Method. After insert the needles, lifting and thrusting the needles for 9 times or you can rotation the needles for 9 times, mainly clockwise. And then lifting and insert the needles in different directions. Finally, insert the needles and pushing down. Keep the qi in that area. That's the technique we call 抽天法, repeatedly lifting and pushing method. Number 13. 运气法, qi transporting method. This technique is used reducing technique and help qi moving to special local area and to stop pain. So insert the needles perpendicular and then lifting or rotation the needles for 6 times. So mainly lifting or mainly rotation the needles to right side or counterclockwise for 6 times. After getting qi, then put the needles obliquely to the directions where the illness or problems area, and then tell the patient take deep breathing for 5 times. So help the qi flowing to the local area. So that's technique. Number 14. 提气法, qi lifting method. This technique is a combination of lifting, thrusting, twisting, and lifting technique. It's a combination tonify and reducing technique and promoting qi flowing. Clinical use to tonify 正气 and eliminate passenger qi, and open the meridians, help qi flowing smoothly, and can remove obstructions or external passenger evadings. So method. Put the needles, go to middle level, that's human's levels, and heavily lifting, slightly thrusting for 6 times. And if you still couldn't feel the qi in there, you can repeatedly, like 2 times 6 or 3 times 6, to see if you can receive the qi. And then twisting the needles. After twisting the needles, you feel more stronger qi and lifting the needles in the shallow level, that's heaviest level, and then keep the needles in there for some time. Number 15. 中气法, qi mediating method. Qi mediating method means harmonize and regular qi. It used to relieve passengers and harmonize yin and yang. So use this technique, we need to thinking about the illness located in the yin region or yang region first. If the illness located in the yang regions, we insert needles to the yang region, means shallow levels, and quickly pushing and slowly lifting for 9 times. After 9 times, and put needles go to deeper, to in regions. Then bending the needles about 45 degrees with the skin, and the tip of the needles directions to the illness directions, and then ask patients exhale for 5 times. Then keep the needles perpendicular for some time. After, and withdraw the needles. If the illness located in the in regions, insert the needles, go to deeply to in regions, and quickly lifting and slowly thrusting for 6 times. After getting qi, and lift the needles to the yang region, and then bending the needle about 45 degrees direction to the illness directions. Then ask patient inhale for 5 times. Then keep the needles perpendicular in there for some time. After withdraw the needles. Number 16. Practice strengthening method. Practice strengthening method is a tonified technique. Is inducing heat sensations. Chronically treat deficiency kind of cold syndromes. Left hand pushing the points, and the right hand insert the needles, and feel qi sensation, then rotation the needles forward, means clockwise, 3 to 5 times. Then when you feel some heavy, then you lifting and thrusting the needles 3 to 5 times. Mainly, heavily thrusting, slightly lifting. And getting qi. Then rotate the needles forward, clockwise, another 3 to 5 times. Then keep the needle there for some time. After withdraw the needles quickly and pressure the points quickly. Number 17. Cold reducing method. This technique can inducing cold sensations to treat excessive heat syndromes. So put your left hand on the points area, and the right hand put the needle in, and then rotation the needles backward or counterclockwise 3-5 times. Then feel qi, lifting the needles and thrusting the needles mainly slightly thrusting and heavily lifting the needles about 3 to 5 times. Then rotation the needles again backward or counterclockwise for another 3 to 5 times. Then keep the needle there for some time. When withdraw the needles, quickly withdraw the needles and with the points open. Number 18. 进火补法 Strengthening method by inducing heat. This technique can reduce heat. It's a combination slowly and faster needling technique and respiration and lifting and thrusting needles, and also shaking the needles. So this technique pretty similar like we talking about burning the mountain technique, 烧山火 needling, and the same clinical indications. It can introducing the heat. The method. Ask the patient, exhale, and then insert the needles in the superficial level, and then quickly pushing the needles, slightly lifting the needles for 3 times. Getting chi sensation, then go to middle level, needle little bit deeply, repeatedly, heavily thrusting and slightly lifting, heavily thrusting, slightly lifting for another 3 times. Then put the needles, go to deep levels, repeatedly, heavily thrusting, slightly lifting, heavily thrusting, slightly lifting for another 3 times. If still couldn't feel heat sensation, then ask patients, inhale by the nose and exhale by the mouth for 3 times. Make the needles little bit trembling in the local area to producing some heat sensations. If heat sensation is felt, the needle slowly withdraw and quickly pushing the points. Number 19. 浸水泻法 Reducing method by inducing cold sensation. This technique pretty similar like we talking about before. 透天凉 Inducing cold sensations. It's a combination reducing technique by the speed, by the respirations, lifting and thrusting and shaking and scraping together. It is similar clinical applications with 透天凉 technique, still producing cold, clinically used for heat condition, reducing some heat, especially excessive heat. The technique. Ask patient inhale and with the left hand like holding the skin and make the skin pretty tight there and insert needles directly to the deep level and getting chi there. When getting qi, lift the needles a little bit, then heavily lifting, slightly insertion, heavily lifting, slightly insertion for 3 times. Then lift the needle to the middle level. Repeatedly 3 times, heavily lifting, slightly insert needle, heavily lifting, slightly lifting the insert needle for another 3 times. Then go to superficial level. Heavily lifting, slightly insert, heavily lifting, slightly insert for another 3 times. Then withdraw the needles quickly and no cover. So that's the technique we call 浸水泻法 reducing method by inducing cold sensations. Number 20. 青龙白尾 Blue Dragon Virgin Tail Method. This technique mainly directs qi to the special illness locations, and the combination with shocking and 9+6 technique, thus clinically used for direct qi to illness direction, reducing some muscles, stop some pain, and clinically moving qi, moving blood strongly, can use for lot of conditions. The technique. Insert the needles obliquely to the shallow region, or you can go to the deep region, getting qi, then moving the needle, go to shallow region again, and then switching the needles, left side, right side, then sending the qi to the direction where the tip of the needles, like the illness or painful in this side, when moving the qi directly go to that side. You can vision the needles 6 or 9 times. Basically, you're sending qi to that directions. So this technique we call 青龙白尾 Blue Dragon Wagging Tail Method. Number 21. 白虎摇头 White Tiger Shaking Head Method. This technique is still combination technique, lifting 13 rotation the needles and swaying the needles, can direct qi to special kind of location. It looks like a tiger shaking its head. Clinical applications so promote qi flowing, usually used for reducing excessive conditions. Method. Insert the needles perpendicular to deep levels, and then shock the needles quickly, like ringing a bell, lifting the needles when shocking the needles. You also can put the needles obliquely to the direction of illness directions, and then shocking the needles. And at the same time, you use other hand blocking the other side of the channels, then sending qi, especially go to the illness directions. Thus we call 白虎摇头 White Tiger Shaking Head Method. Number 22. 苍龟探穴法 Black Turtles Exploring Hole Method. This technique combination with slow quickly needling and directions promote qi flowing. So that's basically clinically try to finding qi from the shallow region to the deep regions and different directions. So go to the points and insert the needles, and then letting the needles go to the different directions from the shallow region and the deep regions and different directions. That's the technique we call 苍龟探穴法 Black Turtles Exploring Hole Method. It's just like a turtles exploring hole. Number 23. 赤凤迎源 Red Phoenix Meeting its source method. This technique combination of slow or faster needling and flaying manipulations is just like red phoenix sparing the virgins. So that's the name coming from. This method promotes qi circulations and getting qi, maintenance getting 得气. Clinically mainly used reducing or treating different kind of pain disorders. The technique. Insert the needles go to deep level first, and then lifting to the shallow levels, and getting qi sensation, then put the needles go to middle level. In the middle level, rotation or lifting, thrusting the needles, and then flying the needles. Basically, rotation the needles 2 times, then fly the needles. Rotation 2 times, then flying the needles. This is the technique we call 赤凤迎源法 or red phoenix meeting its source method.